In the first season of HBO's The Pitt, viewers meet a team of talented doctors who are willing to do just about anything for their patients, yet sometimes, the best care comes with some serious rule breaking. Released in January 2025, The Pitt has quickly become a must-watch medical drama. It has not only been praised for its medical accuracy and juicy drama, but for its ability to nail down the big issues that plague healthcare workers every day. Every member of the Pitt's cast contributes to this wonderful web of storytelling. There is little doubt that the doctors, nurses, and students that appear on the Pitt are good at what they do. The Pitt Season 1 showcases some incredible saves and plenty of impressive medical technology. However, good medicine does not always equate to following all the rules, and in fact, the Pitt offers plenty of moments where rules are broken with mostly good intentions. Though not all of these decisions have happy endings, they speak to the rigidities of healthcare and the lengths that are gone to in order to save someone's life. 8. Treating patients without X-rays and tests. What the Pittfest shooting proved about medicine. One pretty general rule that is broken in the Pitt is doctors treating patients without first taking X-rays or completing other important tests. Typically, medical workers are mandated to do tests in order to get a better idea of their patient's ailment so that they can use the best treatment. However, in the face of the Pittfest shooting, Dr. Robbie and his team were forced to act fast so that more lives would be saved. There was no time for X-rays. Thus, they were ignored completely. Medical tests are an integral part of diagnosis and treatment, but the Pitt shows the rare occasions in which they are more of a hindrance than a help. When so many critical patients are brought into the ER, there is no time or space to take them through long tests. Instead, it is better to treat first and ask questions later, if only so that person's life isn't lost in a waiting room. Ultimately, this is a broken rule, but one that is for the betterment of patients. Another similar rule that gets overlooked in the Pitt Season 1 is trainees completing procedures without the supervision of an attending. Because the Pitt is a teaching hospital, certified doctors are joined by med students and interns. These figures, like Whitaker, Santos, and Javati, are there to assist, learn, and gain experience. Yet, during high-stress moments, some of these characters found themselves carrying out treatments that should have been done by a more experienced colleague. Santos is definitely one character who tends to do things without supervision, but another strong example is when Mohan treated her poisoned influencer patient without Robbie's approval. Though Mohan was right, she went over her superior's head in a way that isn't tolerated in medicine. The Pitt mostly shows this type of rule breaking in a positive light, but in real life, this scenario can go very wrong and may lead to physical damage or lawsuits. Robbie letting Jake see Leah. Robbie's misstep backfired. Among the Pitt's various staff members, one of the most rebellious is Robbie. One troubling rule he breaks during the Pittfest episodes is allowing his Jake to see Leah's body in the morgue. Due to the nature of Leah's death, no one would be allowed to see their deceased loved ones until a proper investigation had been completed. Of course, Robbie's personal connection to Jake made him bypass this rule so that Jake could see his girlfriend one last time. Unfortunately, this is one of the rule breaks that did not work out so well for Robbie. Despite acquiescing to Jake, Robbie ends up getting yelled at for not doing enough to save Leah's life. Overcome with emotion, Jake blames Robbie. This sends the doctor into a spiral of anxiety, which is his ultimate breaking point in the show. Moments like these prove that even with the best intentions, breaking rules can result in bad outcomes. 5. Robbie using extra resources on Leah. Robbie's personal issues got in the way of his medicine. Within the same vein, Robbie also erred by using extra resources on Leah, despite knowing that she probably wouldn't make it. Initially, Leah comes in with a gunshot wound but is still conscious and talking. Her condition then takes a nosedive, and Robbie must try to stabilize her so she can go up to the operating room. After several blood transfusions, Leah gets no better, and it is clear that she is beyond saving. Rather than giving up, Robbie goes a little too far than necessary to try and save her. Truthfully, this is one of the less strict rules of medicine, but is an important situation nonetheless. It is definitely important for doctors to take every measure they can to save a patient, but it is also important to know when the situation is too far gone. This is especially vital during Pittfest, when other patients need the resources being used on Leah. In this moment, Robbie is letting his personal feelings outweigh his medical knowledge, and it doesn't work out in his favor. Robbie and Colin's changing pregnancy ultrasound results. The Pitt shows the complexity of similar situations. One of the more controversial choices that is made in the Pitt is Robbie deciding to tweak the results of a pregnancy ultrasound to allow a teenager to get an abortion. In the episode, Collins is treating a young woman who wants to have an abortion, yet she hesitates to follow through because, according to the ultrasound, the fetus may be too far along based on state abortion laws. Collins and Robbie agree that the teen shouldn't be forced to have the baby because she is a few days further along. Thus, Robbie agrees to change the results. The Pitt tackles countless important social issues within a medical context, but this rule break may be one of the most compelling. It is clear that the teenager is deeply afraid of having a child and isn't ready yet to do so. Collins feels it is wrong to force her to have the child, especially when the difference is so minor. Through this situation, the Pitt sheds light on the complexities of these situations, showing how seemingly small details have massive effects.